Part 1 is already up on the channel for you to watch, and this is part 2.
I'm very excited to have him today with us because he has such a rich bio. So his name is Dr. Prateek Makwana. He's a director of Vasundhara IVF and a consultant embryologist. He has worked with various organizations like SPAG Asia, YTP Foundation.
Thank you so much for taking out time and joining today's podcast episode.
Of course, we're still trying to figure out. As doctors, we have no idea. Scientists, we have no idea. PCOS is the most common endocrine disorder, especially in women who are in the reproductive age bracket. A teenager comes to me and if they're diagnosed with PCOS, be that you're very lucky that you're diagnosed this early. What happens is, especially in pregnancies with PCOS, you're more prone to getting diabetes. Miscarriages are pretty common in PCOS.
I think we should end this debate today. Does PCOS and PCOD mean the same thing? Because every time we make content and we say it means the same thing, people don't believe us. So it would be nice if a doctor tells it to people that does it mean the same thing.
अभी हमने story डाला था ना, people with PCOS please reply. They were like, I have PCOD, is it the same thing? Can I please apply? I'm like, oh my god, we need to do the podcast first, then only we'll do everything else now.
Yeah. So just to put the question again, does PCOS and PCOD mean the same thing?
I'll tell you something. Now, see how in diseases, as time changes, people look to update the names of the diseases. So initially it was called Steyn-Leventhal syndrome because of the two scientists, Steyn and Leventhal.
Okay, good we don't call it that anymore.
Yeah.
Because that would have been difficult to talk about regularly.
Then, over the time people started to come up with a new name for the disease, and then they call it Polycystic Ovarian disease. But then people realize it's not one disease; it's a combination of different syndrome. It's a more metabolic and hormonal condition. So then, instead of calling it disease, they updated the name to Polycystic Ovarian Syndrome. So PCOD is just a very old name for PCOS, which is no longer. So we like how STDs became STIs.
Yeah.
Because they're not disease, they're infections. So that differentiation was created. So PCOD is just a very old name. And I don't know why doctors and general public still use it, but because it's people, it's now ingrained in their head.
Yeah.
So that's why a lot of times when you see a doctor or someone, from the healthcare industry on Instagram, they would just write PCOS/PCOD. Like headache hi nahi chahiye humko.
Yeah, that's something even we have been doing so that people don't get confused. So we also write PCOS/PCOD for content.
Yeah.
But yeah. Okay.
There was once on Instagram, I saw some doctor. She made a video. Not doctor. What's a very famous Bollywood Pilates instructor. Okay.
Whoa.
So, not taking any names, but yeah.
So she mentioned that they're different.
Oh yeah. She did a full breakdown, and what she said. PCOS, the PCOD is an endocrine disease and yevo. And then she goes and says something for the PCOS, which is the exactly same thing in different words. Like, are you even thinking to yourself,
As a doctor, you're like, हाँ तू सिखा दे कुछ नया ही बता रही है.
नहीं हम पीछे बैठ जाते हैं, you take the front seat.
आप ही आ जाओ कल से क्लिनिक में. वैसे भी we are having bad experiences. Might as well one more. Who knows from where?
Yeah.
I was feeling, I had a very strong feeling to just comment. Can you say it again, but slowly? Like, no, let it be.
So Prateek, I just wanted to ask you one very important question. How can someone understand that they should be diagnosed with PCOS? Like, what is the criteria to be diagnosed for PCOS?
Okay, so in PCOS, there are three important pillars, as we call it, right? One is when your androgen levels are increased, which is your testosterone. The second is, say if you go for a regular ultrasound and you see polycystic appearances in your ovary, right? That is one criteria. And the last one is if you're having irregular periods or no periods at all for a long duration of time. That's also one which you should go and definitely speak to your doctor about, because these three things do play an important role. And I think if you fulfill any two of these three criteria, you would be considered, you'll be diagnosed with PCOS.
Got it. And just to that question only, people should not self-diagnose themselves, right? Because a lot of people are self-diagnosing these days based on what Instagram is telling them. So that can be harmful, right?
Self-diagnosis is, it can probably do you more harm, because then you would look for advice from your families and friends, and then you'll follow that and then you'll think it's working. It might harm you, it might delay you seeking a treatment. Either way,
Yeah.
it can just, in a negative way. So
Yeah.
if you have any doubt, if it's been persistent for a long time, and if you really feel that, you really need to go visit the doctor, definitely go visit.
So I want to get your reaction on this. So first, I was told when I was diagnosed, say like 10, 12 years back, that I was very skinny to have PCOS. So then that time I was made to feel like, तुम बहुत पतली हो, तुम्हें हो ही नहीं सकता, पता नहीं कैसे हो गया है. Take medication, strong medication, those 21-day contraceptive things and thyroid medication, everything was given to me. It was not helpful. In fact, I felt unwell after that, so they changed it. Uske few years baad, like 5-6 years baad, I gained like 4-5 kgs weight. And that's when now they had this new bone to pick with me. अब मैं हमेशा चाहती थी तो weight lose करो, workout करो. Like, okay, it took me a while, but I got into the groove. So after that, I've been working out consistently for like more than a year now. And I go to them saying, I have done everything you've told me. The diet is there, the workout is there, the lifestyle is there. Now my weight is the same, my hormones are the same, medication is the same. Now what can I do? And then last, इसके बाद मुझे बोला, okay, now it's your fault only. Maybe you're lying to us. Maybe you're not taking medication. Yeah, maybe you are eating more than you are telling us. So it is your fault and you only must be eating. So now a week back, I have been given on paper 1,000-calorie diet. Ki now you're working out so much. Now you should eat very less and let's see if you lose weight and we'll figure this out. And as soon as the doctor wrote the words 1,000-calorie diet on the paper, I was like, इनके पास दोबारा नहीं आना because this is harmful advice. इतना तो मुझे पता है. Now you tell me, what do you feel? My years of victim blaming that I have endured.
From the get-go, I would have said change the doctor. Unfortunately, that's
these are 6-7 different doctors, by the way.
that's even worse.
Yeah.
But yeah, I've heard of quite a lot of people going through very shitty experiences. That does come down to the doctor. You cannot, blame anyone else in this particular thing. And it's very important to treat whatever condition you have. See, you cannot have a blanket treatment for everyone. Even if it's a condition, you can have a protocol, but the treatment has to be individualized based on the person that's, in front of you. And so it's very important. I hope a lot of people do right now are, more focused on treating the patient rather than just treating whatever it's written in the books. I think that's the approach that people should have.
Yeah. Also, don't you think like a lot of people forget the stress aspect of PCOS and they focus a lot on the weight gain? Because I feel like in my journey, stress has played like a huge role in my PCOS and how it makes me feel. And that can be worked with a lot of other professionals like a psychologist or a psychiatrist alongside. So I feel like the treatment, like you said, it could be more holistic and not just like, one size fits all kind of situation.
Absolutely. See, PCOS will affect a lot of things in your in your life. It's not just your weight, right? A lot of things will change. But I think stress, we all know that the brain is the most powerful organ. And if you're mentally unwell, no matter how good you're feeling about yourself, if you're mentally not feeling good, you won't be able to just, go ahead every day after day. It'll bog you down after some point. So it's very important. Stress is considered a very key area in PCOS. I think right now people do consider, I'm really not sure about how it was 10 years back or 5 years back, but at least in my contemporaries, what I've seen is that, they do take stress very seriously and they do suggest ways to reduce stress. They probably themselves are not qualified, me either, but then we have people like Saloni and other people are also available. So
Yeah.
Hormonal fluctuations like these do impact motivation, mood, stress, like you said, where people with PCOS store fat, where people who are diagnosed with thyroid or type 2 diabetes, insulin resistance, where they store fat is also very different. So, how would you ask someone, especially a teenager, to deal with such a diagnosis? Because the common experience here is that when you're diagnosed when you're really young and you've just found out what periods are, what sex is, what reproduction is, you are already freaked out by this idea of bleeding every month, and now you have been told you might not. It's just a lot of things, and then people are commenting on your weight, your mood and depression, plus all the stress of being a teenager, the exams. How should a teenager deal with this? What questions can they ask? And how, like a basic understanding so that they are very clear कि क्या हो रहा है मेरे साथ.
right. So if a teenager comes to me and if they're diagnosed with PCOS, my first line would be that you're very lucky that you're diagnosed this early. Because there are people who are only diagnosed when they're trying for pregnancy, and when they realize they're unable to get pregnant, they come and not say, oh fuck, we have PCOS, and that's now that's pretty late. Now the the interventions have to be that much more quick and more intense. When it's diagnosed early, the benefit is that you can start managing it from the get-go. See, PCOS can be treated, it cannot be cured, but it can be treated to a point that it no longer affects your life, in a manner that it does. And obviously, the sooner you start, the sooner you'll be able to manage it much more efficiently. Plus, also you'll get used to managing it. So if there are flare-ups down the line, you exactly know what you're going to do.
Yeah.
The changes wouldn't feel that big compared to someone who has already suffered from it for 10 years without any diagnosis. And then coming now, the changes for them would be pretty drastic. So just making them realize that, also I think just making them realize that, as a lot of people do consider it to be a very rare disorder, which is surprising. So just making them realize that you're not the isolated person who's suffering from PCOS. It's pretty common, it happens a lot, and it can be managed. Just giving them that satisfaction and giving them, that hope that can be managed, can be treated, is I think goes a long way. As far as people making fun and people criticizing, I mean, that's down to their mentality, and unfortunately, I hope it changes, but unfortunately, I mean, I don't really see an improvement in that, because people in teenage are like, just how insufferable.
Yeah, exactly. That's why I feel so bad for teens, because you're already on this cusp of puberty and everything. And there's so much to deal with. On top of that, if you have all this, it's like, my God, so much mental pressure. But also for people who don't get diagnosed till the point that they have to conceive is another. You've had all these things all your life thinking it's unexplained. Suddenly you have all the answers, but you don't have enough time to work on it. So both the situations, my heart goes out to people.
Yeah. Like you said, like Prateek, like you mentioned, that a lot of people get diagnosed very late in life, and that's a little unfortunate. But like, since I've been working a lot on ground, I feel like there's a very sad statistics of the number of people who never get diagnosed in life. And that is like something that, a lot of people don't talk about. So, like, what happens if someone gets undiagnosed? Like, does it like impact their life on a regular basis a lot more than people who have been diagnosed earlier?
See, now with PCOS, it can lead to other problems also. Like I said, with PCOS, you can get pregnant naturally. Okay. Now, people who usually go undiagnosed, they stay in tier 2, tier 3 regions, which even if they have access to medical care, they're not that open to going, or they'll only go for a specific thing, right? Plus, the lifestyle over there is not like in cities where the lifestyle is more office-based, sedentary. So they're always working out in the fields, or they have long distances to travel, sometimes by bus, sometimes by walk. So they are constantly on the move. So for them, usually that 5-10% reduction in weight which I'm talking about, it happens pretty quickly, and it's already their life. So they're not usually picking up that much weight. So for them to get pregnant naturally is a possibility.
Yeah.
If they're getting pregnant, if they're giving birth to their child, people are thinking everything is all right, nothing is wrong, right? So that PCOS that goes undiagnosed. Now, after a while, say when they reach a certain age, and they're like 35, 40, and now suddenly starts to build up. And then you start seeing certain changes in them, right? They could be seen early also, but they probably just brush it off. But then you see those certain changes. And now what happens is, especially in pregnancies with PCOS, you're more prone to getting diabetes in pregnancy. It's called gestational diabetes, right? That's pretty common. Miscarriages are pretty common in PCOS. So sometimes especially when we have seen patients coming from these very isolated areas, and they come with, 3-4 times you've tried getting pregnant, her bar, it couldn't reach the full term. And then you diagnose it and you see it's PCOS. So miscarriages are pretty common in PCOS, so it will affect your other parts of life also. Because if you develop diabetes even after a successful pregnancy, it's going to affect the quality of your life going forward, right?
Got it.
It does, and it also opens you up to a few cancers, which is not a good, not a good sign.
Yeah.
So it's important to get diagnosed, get treated accordingly.
So, after discussing both of you, I think one thing we have established is that the only thing predictable about PCOS is that it's unpredictable. You can't decide what's going to happen. But one thing that I really wanted to ask you, because we have a lot of guys who are watching this podcast right now. Is there something that you would tell guys? Like, do they also need to know about PCOS? Is it important for them to be a part of the conversation? And what can they do to, join this movement?
See, I think one of the more important things for guys to understand is that if you see someone who's suffering through something, or even if you don't know this, just from the get-go, stop making fun of people and just be kind, because you don't know what they're going through. So you might go ahead and call them names or fat shame them, or whatever. If they have hair on their face, you might make fun of them. You never know what's going on behind the scenes. For you to just add on to it, it's just pathetic. That's something that people need to understand, not just guys. I think even everyone needs to understand this. Second, especially for people who are trying to get pregnant, for couples who are trying to get pregnant. Now in India, unfortunately, there's a lot of, even if the couples are educated, the families have a lot of, that those preconceived notions of blaming the women always for not being able to get pregnant. So I think in that family, but at least the guy can be supportive, even if the wife is suffering from PCOS, if she's suffering from something. If the guy is suffering from male infertility, whatever the reason, it's very important to be supportive to your partner. So in this particular case, if your partner is suffering from PCOS, don't stress them out even more, because they're already pretty stressed. So that's just something that they can do.
So if you have nothing nice to say, don't say anything at all.
It's all shut.
Okay.
Let the doctor speak. If you really are concerned about, say, somebody in your life and their weight gain, take them to the doctor and let the doctor speak. You don't need to give your own analysis on their body.
Tiffany.
Exactly. That's not absolutely true.
If you're so concerned, help karo na. ऐसे क्यों रुला क्यों रहे हो यार बंदे को?
Exactly. Like if you cannot support someone, don't become a hurdle. It's as simple as that.
Got it.
So, like we said, sadly, there are a few major symptoms that people can meet, but it's not necessary that they will have all of them or some of them, and how they will present. So yes, this is a complicated syndrome, but in terms of lifestyle, nutrition and treatment, we can still all follow similar things, I feel. So can we talk about how nutrition and exercise or lifestyle plays a role in managing PCOS?
Absolutely. They are sort of the cornerstones. Even before we offer patients or we recommend patients to take medication, we would prefer that they just make some minor improvements in their lifestyle, and that should do it. Sometimes you do not require. Sometimes when you have already developed insulin resistance, you might require medications to help you reach that stage much quicker and to manage it for a longer period of time. But just, and when it comes to nutrition, exercise, you don't need any 1,000-calorie diet or keto. All you need to do is follow basic advice. The most cliched advices are all the most applicable ones, and also the most difficult to follow, because people don't see results in 10 days, 30 days. It's a long-term process, and you have to sort of commit to it. But it's totally the end. Yeah, so just basic things like taking your micronutrients, not forgetting your vitamins, minerals, because people obviously forget that. And just working out even 30-40 minutes a day, 4 or 5 days a week. Just consistency is good enough. You don't have to go all out every day.
Yeah, I think a lot of
movement is not exercise.
Yeah, I think a lot of any kind of movement, if not exercise, she said.
Yeah, anything that makes you feel, gets your heart pumping.
People get very stuck up on diet बताया है तो कुछ बताओ कि ये नहीं खाना है, ये खाना है. But it's more like common sense लगाओ ना, जो चीज processed है बहुत ज्यादा, अगर आप सिर्फ वही खा रहे हो, you're not eating fruits and vegetables, so realistically आंसर करो ना, कहाँ से मिल रहा है आपको अपने विटामिन्स और मिनरल्स और फाइबर. वो नहीं है तो कैसे होगा? इट्स ऑल those things which you know but people don't understand. एक्सरसाइज बोल दिया तो जिम चाहिए, ट्रेनर चाहिए. Go for a walk with your friends, you will feel mentally better also, and that way 1 hour or 2 hours you'll end up walking downstairs in your building, you won't realize. It's those simple hacks you have to do, or take the stairs, walk a little bit before you take a rickshaw or a cab. These things people can do, but जब वो ऐसे आ जाता है ना, PCOS है, इसे ठीक करना पड़ेगा, then you're like, पैसा खर्चा करते हैं, डाइट लिखवाते हैं, ये लिखवाते हैं, but it's not that important.
Yeah, I think you made a really good point. Sorry, I'm just cutting you off here. You make a really good point when you say that just cut processed food out of your diet. It'll all go a long way. Just stick to your organic ingredients and you'll be fine. That's a very important point, because people are like, listen, there's a concept, that calorie surplus means you'll increase weight, calorie deficit means you'll decrease weight. People just take it as black and white, but it's the quality of those calories, they also matter a lot.
ऐसा नहीं कि 1,000 calories, sorry, 1,000 is very less actually, still 1,300 calories. 1,300 to 1,500 calories में 10 पैकेट चिप्स आ रहे हैं, तो उतना ही खा के जी लिए will not work.
Exactly.
That's the learning. There are other menstrual issues also that are slightly similar, so you should always get it checked.
With menstruation, a lot of symptoms in a lot of conditions overlap with each other. So, painful periods, amenorrhea, heavy bleeding, spotting. You can confuse it with a lot of things, and sometimes it could be nothing also. It could be just your normal cycle. Maybe just that particular cycle is a little different from the rest. It could be nothing, and it could be something else. So definitely, self-diagnosis in this case is a pretty bad idea.
Yeah. On a scale of 1 to 10, how important do you think is it for people to measure their sexual activeness to the gynaec or the professional, no matter what the concern is?
I would not be able to answer this question on a scale of 1 to 10. It depends a lot on what kind of treatment or what kind of condition you've gone with. So your history related to that condition will justify your sexual activeness. In PCOS, it doesn't matter unless you are trying for pregnancy. So, unless you're trying for pregnancy, if you're trying for pregnancy, the doctor will obviously ask you how many times, you've had unprotected intercourse and for how long, because that matters in infertility. For a gynae treatment in PCOS, sexual history does not play a role unless there's something specific that the doctor wants to touch upon. Otherwise, nothing else.
Okay.
Yeah. So all the times when doctors force you to take a pregnancy test, even if you've told them that I've never been sexually active, but they don't trust you. They're like, आजकल के बच्चे झूठ बोलते हैं, and तुम्हें 3-4 महीने से periods नहीं आए हैं, so go buy this test and do it in front of now, and then we will start the rest of the conversation. So would you say that's unethical?
I would say that's definitely not the right thing to do, because see, first, you cannot force a patient to take any test, right? If you are, then that's just plainly wrong. You can suggest or recommend them, taking the test is on them. Unless it's a critical situation, that's a completely different case then. But you cannot force someone to take a pregnancy test. Also, I mean, if you have, see, now there's another side to it. So it's a very gray zone. Now sometimes what happens, people, there have been cases where people have completely not revealed their sexual history and the fact that they were pregnant, or they didn't know they were pregnant. It's only when, whatever reason, they were on the operating bed, when doctors do a check, they're like, oh, there's a baby growing inside the patient. So a lot of these, it's a gray zone. Like, some people, because of their experiences, also choose to go down this road. But there's obviously a way to do it. You cannot like badger the patient into taking the test. There's a certain way. Explain why you are making them take the test. Ensure them that it's for their own safety. And if the patient agrees, maybe yeah.
Even I don't blame doctors. Like you said, there are people who come up and they have a sexual history or not, and they are not disclosing, or for some reason, doctors have to deal with a lot of people who are not honest, and then this is how they end up behaving with everyone.
Yeah.
So
yeah,
that's just their experience.
Also because a lot of medications now in our field, a lot of medications are not safe for pregnant women. So if they have not disclosed that they are not pregnant, or if or if they are just not aware that they are pregnant. Now, sometimes this also happens. I have seen a patient finding it out at 17 weeks of pregnancy that she's actually pregnant. So a lot of times people don't even know that they are pregnant. So before giving any medication, especially in a situation where it could feel, then I think that's why I think. But again, there's a way to ask for a test. There's a way to recommend a test. The patient should be completely aware of why they are taking the test, what this test will do for them, and how it will help in their treatment, and how it will help the doctor, suggest a better course of treatment. When the patient is confident in the treatment, they'll do it themselves. But if you ask them, if you order them to take it, of course, they'll have resentment and they'll be like, why should I do it?
Yeah. It goes both ways. Like, even the doctors have to create a safe space where they feel comfortable sharing the things that are confidential. And even the patients need to know that lying will do them more harm than the doctors. So I think like both of them need to be sensitized about the importance of being honest in a clinic.
True. That's absolutely true.
And I don't think it's either person's fault, because it's in our culture, right? So I can understand from the doctor's point of view, say they are 30, 40, 50 years old. In their generation, people who are at the age of 13, 14, 16, 18 were not sexually active, did not know all of these things, but now they are. For some doctors, it is a bit shocking, maybe morally wrong, unacceptable. They do not like to talk about all of this. They don't like this generation mein jo bhi chal raha hai. So they come with a little bit of bad apprehension and say our generation who is doing it, not doing it, whatever, but we don't talk about it to someone who's much older. So when our generation goes, we might not be truthful, and when they ask, they are asking from a place of this stigma. So there's so much judgment both ways that the treatment path is not being found.
True. Yeah, I think a good way is, see, the doctors have also grown up in the same society as people who are not from the medical field. So they will also, books में पढ़ते हैं, घर पे जाके तो वही सुनना है जो society बोलती है. So उनकी भी conditioning तो वही होने वाली है. Yes, they will know a few things about their field, but social conditioning तो सबकी same ही होने वाली है. Unless they come from a family where the parents are, like making sure that the children are learning the things which are correct. Otherwise, all around, in general, the conditioning would be the same. Now, in a medical field, I think even if you're a very senior doctor, if you are a junior doctor, because see, the junior doctor can learn from the senior doctor, and the senior doctor needs to stay updated and learn from the junior doctor as well, so that they're less judgmental,
Yeah.
So those I think especially for the medical field, I'm not talking about the general public right now. But it's important to stay updated and to be open to receiving new information in whatever form it may come.
Yeah.
That is pretty important, especially in the medical field, because you're talking to people, you're speaking to people, you're trying to make their life better. So that should be on.
Yeah.
I think in PCOS, if you have someone who's been diagnosed with PCOS, we don't have to stress on it too much. I know it's not easy, but it's absolutely treatable. And sometimes you do not even require major interventions. Just very little tweaks over a long period of time. ऐसा नहीं कि एक दिन में ही सब कुछ करना है. Over a long period of time will just help it make your life a lot better. And you might actually just treat PCOS.
Got it.
Yeah, this podcast has been very eye-opening. जैसे मैंने पहले भी बोला था, I've been living with this diagnosis for like much more than 10 years, probably 12-13 years now. And फिर भी बहुत सारी चीजें जो मुझे आज पता चली, बहुत सारी चीजें, experiences जो मेरे साथ हुए, which I could get them off my chest today and share with everybody, and also have a doctor react to it and give us the right course of action from here. So, I hope this has been as helpful for the people watching as it has been for me. And yeah, आपके जो भी comments में doubts होंगे, you can ask and we will try our best to answer along with Prateek. If you are available, we can take up a few comments and answer.
Yeah. I'll just end. I just want to tell all those people who are watching this that it's not the end of the world if you're diagnosed with PCOS. You can definitely manage with the right, options if you try. I have been diagnosed with PCOS for since the past 5-6 months, I think. And finally this month I got my period on time. And it was because last 6 months I've been trying to cut down on a lot of food and a lot of junk, and I've completely cut down on soft drinks, completely, like beet, Maaza, Tropicana, and nothing that is like. And one thing that I realized is I'm glad I'm diagnosed with PCOS, because without this I would never cut down on sugar drinks and things that are harmful for me. But at least now I have a reason to cut down on these things. So for all those who are struggling alone, I hope you all know that you're not alone. There are a lot of support groups that are available that you can join and get information on. And there's a lot of support available. Please seek support if you need it.
Yes, we are all looking at the bright side of this, and we will meet you in the comment section to offer support as much as we can. And thank you once again, Prateek, for being here today and answering all of these amazing questions. Thank you, Saloni. That's the end of today's podcast.